Although pills have revolutionized the way that urologists treat erectile dysfunction, for many patients they simply don't work. Where do those patients turn? Well, there's been a solution that's been available long before the pills ever came on the market, but only now has it received the attention it deserves as more and more patients and doctors alike are more willing to talk about this condition. The treatment that I'm referring to is vacuum erection therapy. It's a very simple, easy-to-use therapy that has almost no side effects and can be used for almost any patient with erectile dysfunction. The vacuum erection therapy consists of a cylinder that is placed over the penis. On top of the cylinder is a mechanism which creates a vacuum within the cylinder. In this case, it's a battery-operated mechanism. By pressing the button, I activate a pump which starts to evacuate the air from inside the cylinder, and that creates a vacuum that draws blood into the penis, in this case, my fingers. I've turned on the cylinder, a vacuum is created, and the penis becomes erect. Once the penis is fully erect, a ring at the base of the cylinder is released. That tightly fits around the penis, trapping the blood within the penis, keeping it erect. After the patient has intercourse and is all done, that ring is released and removed from the penis, and the penis can become flaccid. Lubricating jelly is used to create an effective seal between the base of the cylinder and the penis, and this device can be used in addition to sexual activity for penile conditioning. It has become recognized now that after prostate cancer surgery or in the event of other causes of severe erectile dysfunction, there can be a gradual shrinkage of the penis over time. The use of a vacuum device like this for conditioning, that is, to cycle blood through the penis for about 10 to 20 minutes a day, not necessarily for intercourse, can restore the length that is lost over time due to severe erectile dysfunction. So both for the convenience of sexual activity without the need for pills or injections or surgery, as well as for the restoration of lost penile length and conditioning of the penis to improve the response of the penis over time, the vacuum erection device is a tried and true remedy that is just as relevant and successful today as it was back 100 years when it was first introduced. When employing vacuum erection therapy for intercourse, it is critical to have a constriction band that fits tightly around the base of the penis. Although the vacuum device will cause an erection, once it is removed, the erection will go away unless the blood of the penis is trapped by a constriction ring. Constriction rings come in a variety of diameters, and if the vacuum erection device does not appear to be working properly, it's probably because an adjustment needs to be made with the size or the fit of the constriction ring. The constriction ring causes no harm to the penis or the urethra if used properly. Using the constriction ring properly means that it's properly fitted, as well as being sure to remove it no longer than 30 minutes after it's placed on. And 30 minutes is usually more than sufficient time for most men's satisfying sexual encounters. As with any treatment, the vacuum erection device has advantages and in some cases disadvantages. The advantages of the vacuum erection device are that it is reusable, there is a one-time cost, no recurring costs for renewed prescriptions for pills or injections. Another advantage is that it has a minimum of side effects. There are no systemic side effects due to drugs, and there's no risk of infection or pain or bleeding as may be experienced with the improper use of injections. The main side effect a person may experience with a vacuum erection device is some bruising if the traction is applied too strongly or if the patient is on blood thinners. In the high-quality prescription-grade vacuum erection devices, there are safety release mechanisms and built-in pressure monitors that prevent over-traction from being applied due to excessive suction. For my patients for whom a vacuum erection device is appropriate, I arrange a meeting between my patient and a representative from University Compounding Pharmacy in San Diego, California. The representative sits and meets with the patient in a confidential private setting, typically in my office, and explains to the patient how the device works and actually allows the patient to use the device and ensure that it is working properly and it is fitted properly. He then helps my patient in acquiring a device. These devices are typically covered by a variety of insurances, including Medicare. This one-on-one personal attention allows proper patient instruction and allows proper acquisition of the device, cutting through much of the red tape that is often encountered with various insurances. I rely very much on this representative. He has extensive training and understanding of erectile dysfunction, and it proves to be an invaluable piece in maintaining the continuity of care for my patients with erectile dysfunction.